Hi, everyone. Thank you for joining us today. My name is Frankie, and I am a student director from Mind Out Loud. Mind Out Loud is a student-led program, and many of the materials during the workshop are student-generated. The information provided on this platform is for general informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified mental health provider with any questions you may have regarding a medical or mental health condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or read on this platform. If you think you may have a medical or mental health emergency, call your doctor or 911 immediately. Now I will go ahead and pass it back to Zoe.
Hi, everyone. Joining us for our April workshop today is Jackie, Mental Health America's Manager of Peer and Youth Advocacy. You already know the power of peer support. This session goes deeper, exploring the history of the youth peer support movement, how it's being embedded in schools and systems across the country, and what it looks like to take your advocacy further. You'll leave with actionable resources and a clearer sense of where you fit in what comes next. If any questions come up during the presentation, feel free to submit them to the Q&A form that we hope to get to by the end of the hour. We will go ahead and turn it over to Jackie, who will be leading the workshop on Youth Peer Support is a Movement. Let's build what comes next.
Thank you so much for that warm intro. Hi, everyone. Like mentioned, my name is Jackie Menjivar, and I'm the Manager of Peer and Youth Advocacy at Mental Health America. Thank you for those of you who are able to join tonight. I really appreciate you making time to hear from me. I'll start first with a little bit of intro, just so that you have some background about what Mental Health America is, where I'm coming from. So Mental Health America has been fighting for mental health for over 117 years. We're one of the oldest, if not the oldest, organizations in the United States that's been advocating for the rights of people with mental illness. Started with this man here in the corner, Clifford Beers. He was institutionalized during a time when inhumane treatment was rampant in these so-called insane asylums that people were being put in. And he experienced a lot of horrific things. When he finally got out, he made it his mission to improve conditions for people with mental health conditions. So that bell you see is the Bell of Hope. It is a literal bell that exists. It is over 200 pounds, and it's made of the melted down shackles that used to incapacitate people in these hospitals. So it's a really significant symbol for our organization and for the work that we do, really trying to take the lived experience of these people with mental health conditions and turn it into something meaningful and purposeful and create change that helps everyone. So for the last several years, what MHA has been doing is building an infrastructure for youth peer support. That's one of many things that we do. The organization runs a really robust screening program. We do a lot of other research, federal policy advocacy. We also have a really large network of affiliates across the country. So you may have a local MHA in your area. We have them in, I want to say, 38 different states, and they provide direct services to communities. But I'm calling in from the national office, so we do that more high systems level work on a national scale. And one of our big priorities has been youth peer support, and that's what I'm going to talk to y'all a little bit about today. I'll also start with a quick intro of our youth programming and what I do specifically at MHA. So I lead up our youth programs. They were founded in 2017, so been around for a while, coming up on a decade now. Originally, it was one program called the Collegiate Mental Health Leaders Council, and it's evolved into a couple of different things. But currently, our two main programs are our Young Leaders Council and Youth Policy Accelerator program. It's cool. They've been spotlighted in a lot of different places. But I really want to emphasize the actionable outcomes from these programs, the work that's being done, particularly with the Youth Policy Accelerator and advancing the field of youth peer support. And you'll see the fruits of their labor throughout this presentation as I link to some of their resources. So let's start with a quick reflection. I know you all can't answer me in the chat, but I welcome you to think about this, take a minute to think back on a moment when being truly heard by a peer made a difference for you. A peer being anyone you relate to, a friend, a close family member. You don't have to share out loud or anything. I just want you to hold that experience in your mind and think about it as we go forward with today's workshop. All right, and I'll give y'all a quick rundown before we dive into the content. In this workshop, we're going to first go over where peer support started, the sort of history and context for peer support, where it lives now, and how we're embedding it in different systems, where you come in, so ways that you can participate in policy advocacy for youth peer support, and then finally, where you can go next, career pathways that are related to youth peer support and youth mental health, for those who are interested in exploring that as a future career path. So starting with what is youth peer support? You're going to hear me refer to youth peer support a lot in this presentation, or in some places it's marked as YPS. But like I mentioned, peers can be anyone that we relate to. It could be based on shared experiences, based on having the same age, gender, cultural background, sexual orientation, different aspects of your identity, combinations of all of the above. It's someone you relate to. And we know from, being young people ourselves that when we face something difficult, we often turn to people who have been there before for support and for help. In youth mental health, peer support often means one young person interacting with another young person, so peer-to-peer interventions. And if that sounds familiar, I'm pretty sure that that's what a lot of you all do as Mind Out Loud representatives and leaders, doing that kind of peer-to-peer programming in your schools, those kind of general education campaigns and mental health education programs. If it's a young person interacting with another young person about this subject, we'd consider it peer support. But I really do want to emphasize the kind of values behind this, because whether you think about it or not, it really is grounded in something very powerful. In peer support, people who share common experiences or face similar challenges come together as equals to give and receive help based on the knowledge that comes through shared experience. Now, that's really important, is that mutual empowerment, right? It may not feel like it, but really what you're doing when you're doing these peer-to-peer interventions is asserting that young people have agency in the process of supporting one another in their mental health and are able to help in a way that is unique and meaningful and distinct from other forms of mental health care. So we'll back up and talk a little bit more about that rich history I mentioned of peer support in general, not specific to youth, but peer support. The whole concept of peer support grew out of a movement of people with mental health conditions pushing back on these systems that treated them like patients and not like people. So like I mentioned before with the history of MHA and Clifford Beers, there's a very dark history when it comes to this systemic institutionalization of people, very inhumane treatment, where people with mental health conditions were seen as problems that needed to be fixed and really lost sort of human element of what they were doing. So it way before the 70s and 80s, this was a conversation, but that's really when it reached sort of public attention and public fervor. This what they call the consumer survivor movement was what it sounds like, a movement of people who live with mental health conditions, who have survived mental health conditions and survived these kinds of inhumane treatments, demanding a seat at the table in how their mental health is cared for. And that's when we talk a lot about lived experience and lived experience leadership. That just means that, the people who have experienced these things for themselves have a right to be a part of the decision making and have a right to be a part of this process and saying, this is what helps me, this is what doesn't, and helping to guide and lead their care. So this was a huge deal when it happened, because it was pushing it up against these systems of how things had always been done, which were very rigid, very institutionalized, very clinical. So this is kind of a revolutionary idea, treat people like people. And it gradually, as we deinstitutionalized as a country and some of these more inhumane conditions started waning, peer support started getting formal recognition in policy and in its funding. So like the Centers for Medicaid and Medicare Services started encouraging states to reimburse for peer support, which is a big deal. That's a federal agency, so the fact that they kind of recognize this as an intervention that's evidence-based and deserves funding, I think was a huge milestone. SAMHSA, the Substance Abuse and Mental Health the agency that handles substance abuse and mental health at a federal level, they also put out like standard guidelines and regulations for peer support, and again called it an evidence-based practice. So something that genuinely shows results and shows that when people receive support from one another in these settings, that it does make an impact positively on their mental health. And a lot of states were doing this sort of state by state of starting to formalize these roles, create certification pathways where you can become a certified peer supporter. In some states, you can become a certified youth peer supporter. I'm located in New York currently, and in New York State, we have a youth peer advocate, is what it's called, certification. So I definitely, I don't know where everyone's located geographically, but I would encourage everyone to take a look at maybe what your state is doing when it comes to peer support, because there's a lot happening that folks usually just aren't aware of. So yeah, that leads us to now. So now youth-specific peer support is starting to emerge as its own field distinct from adult peer support. And this generation, your generation, is really shaping what it will become. So that's a really exciting point that we're at now, where folks are getting more invested in researching and really seeing the outcomes of youth-specific interventions. So yeah, that was a very abridged version of this history, but I just want you all to know and understand that whether you realize it or not, what you're doing when you're doing those peer-to-peer interventions is part of a very rich lineage, and it's something to be proud of and to remember those core values of mutual empowerment, self-determination, hope, and collaboration and recovery. Those are the things that we want to keep in mind when we're doing this kind of work. So I do want to be clear that peer support is a framework, not a program. So when I say youth peer support, I don't mean just like one singular program that gets replicated everywhere. It's a reimagining of the whole way that we treat youth mental health and the role that young people get to play in it. So it can extend beyond the classroom. For a lot of people, they first encounter youth peer support in schools. So things like the work that you all are doing, those kind of like school-wide education campaigns, or sometimes that schools will implement like peer mentor, peer buddy systems, things like that. That's definitely an example of youth peer support, but I want to emphasize that that is by no means the extent of it. In an ideal world, any young person would be able to receive peer support wherever they are. Anyone who could benefit from it would have access in a lot of different places. And we're starting to try to embed youth peer support in a lot of different systems. So you can find youth peer support programming in community behavioral health centers, embedded into crisis response. So in some states, there are locations where if you call 988 or have like a mobile crisis team that responds to those calls, they're required to have peer supporters or youth peer supporters in that crisis response team to be able to help supplement that work. Similarly, a lot of hospitals are starting to get peer roles, including youth peer roles. So when folks are inpatient for psychiatric care for hospitals, they can be connected again to that peer supporter, which really makes a difference, because sometimes when you're just being confronted with, medical staff and administrative staff, it can feel a little overwhelming. Sometimes it's nice to just hear from someone who's been there before and who's kind of in a similar space as you. And there's a lot of other systems that could really benefit from youth peer supporters. Juvenile justice systems are starting to introduce them. The foster care system and other sort of like child-facing systems are starting to integrate youth peer supporters. There's one group out of Hawaii, Epic Ohana, that works a lot with foster youth, and it is their youth peer advocates are former foster youth or foster care involved youth. So again, it's really meaningful when you're able to take your own experiences and use that as something helpful in someone else's recovery. So there's a mutual benefit to it, both the person receiving support and the person giving support. So yeah, all that to say, peer support is way beyond the classroom. It truly is embedded in all sorts of places. And what we're really trying to do is build a field and a workforce, build a model and a framework to help continue to grow and to scale this. And it's sort of happening in different ways and at different levels depending on where you are. So this is where you all come in. If you're interested, we really can always use legislative champions for this work. If we want to make youth peer support available for every young person who could benefit from it, we do need policy change, because again, we're building the infrastructure that's going to help support this kind of work. So usually these policies, the main ones that we advocate for, center around funding, research, and workforce development. What that means, funding is pretty straightforward. You need money to be able to run these programs, to be able to pay peer supporters. So policies that provide funding for these programs are so crucial, and especially sustained funding over time, not just a one-time grant or one-time allotment of money. We want to be able to have these systems in place for a long time in the future so folks can rely on them sustainably. Then research. So that ties sort of into funding, where folks want to make sure that they are funding and investing in resources that work. And we do know that youth peer support works because as new of a field as it is, there's already emerging research that shows this. For example, there's one peer-to-peer intervention run by a group called Sources of Strength. They're in a lot of schools. They might be in some of your schools, but they recently ran a very rigorous a very rigorous study funded by the CDC that showed that schools that implemented their peer-to-peer programming saw a 29% reduction in suicide attempts, which is a very big deal. And again, it was a very rigorous, it was called an RCT, a randomized control trial. Essentially, it's one of the more rigorous things you can do to like prove the impact of your programming. We need more of that strong research. We need more evidence that these things work, because sort of intuitively we know that they work, but we really need to be able to point at hard numbers. And to do that, we need to fund research into youth peer support. There's a good amount of evidence out there for adult peer support, but youth peer support is still emerging. So any policies that have set aside specifically for youth peer support research, we really want to try to advance. And then finally, workforce development. Again, at the heart of this are youth peer supporters themselves, the young people who are doing this work. We want to make sure that folks are trained, that they feel prepared and comfortable to go into these spaces and do this very important, but also very deep and sort of emotionally taxing work, and that they're supported when they're doing that. For example, there's a youth peer support program called Youthline out of Oregon. They operate young people operate a sort of like crisis/mental health response line, both via text and via phone. And they offer a dedicated support line specifically for their workers. So if at any time during that process, a young person who's operating that phone line needs that extra bit of support or just has to take a step back, there's people there to be able to help them. So those are the kind of supports that we want in place for youth peer supporters, because we want to make sure that they're safe, that they're comfortable as well. Again, we're building an occupation, we're building a field, and that takes a lot of kind of scaffolding to be able to do. We can talk specifics. So at least at the federal level, which is a lot of the work that I do, these are some policies to kind of keep in mind and keep a lookout for. On the federal level, so that's in Congress, we've got the Early Minds Act. That is a piece of legislation that's currently live. It has been introduced, and it would expand youth mental health services. Essentially, it would allow funding to be used for early intervention and prevention, not just as crisis response, and that would include youth peer support. So that's a really important one that we're trying to push for at the moment. Then we have the Youth Mental Health Research Act, which would just expand funding for youth mental health research, again, which would include youth peer support, which is so important. And then finally, the Peer-to-Peer Mental Health Support Act. I don't know that this has been reintroduced this year. It was last year, but didn't make any progress. But this would very explicitly fund youth peer support services in schools and allow schools to start piloting programming for peer-to-peer interventions. And if this feels really in the weed for you, that's totally fine. There's a lot that you can do even at a more local and smaller level too, because a lot of this work is actually happening at the state and local level. So like I mentioned before, a lot of states are offering specific youth peer support certifications. A lot of states have their own grant programming for funding. There are states that will fund youth peer support programs out of their substance use budgets, or fund it from their budgets for like suicide prevention or wraparound services. So states are getting really creative in the ways that they're funding these programs. One state in particular, Illinois, for a while, I don't know if they're still doing it, but they were using tax revenue from legal cannabis sales, like adult cannabis use. Part of the tax revenue would then go towards funding the training for young people, like college students who wanted to get certified as recovery peer support specialists. So again, really like unique and innovative ways that states are funding these programs. So when things feel like they're moving at a glacial pace at the federal level, keep in mind that in your own backyard, there could be a lot that's going on and that you can still take action on. Standards and supervision is another one. Different states have different standards. Some states don't have any standards, and that is also its own issue, right? Like that is something else that you could advocate for, is advocating for standardized regulations and trainings for youth peer supporters. And finally, this big one is crisis response integration. Like I mentioned before, with the expansion of 988, which I'm sure you all are familiar, but 988 being the new sort of emergency code or emergency number for folks who are experiencing a mental health emergency. With the expansion of 988 in states, more states and localities are starting to integrate youth peer supporters within their crisis response, which is really, really cool. But it's happening sort of on a case-by-case level. So I'd really encourage you to check out this resource. This is one that Mental Health America put together, our state youth peer support policy toolkit. You can see what different states are doing. Not every state is in there because not every state's had recent action around this, but it's a good kind of snapshot at a couple different programs, a couple different states, and a couple different models for how folks are handling this topic. So here's a question. Have you ever contacted an elected official or attended a public meeting about mental health? So that could be like a school board meeting. That could be talking to your local representative. React with a thumbs up emoji if you have. I think I should be able to see. Okay, we got a couple. I'll take that to mean that maybe, okay, yeah, here we go. Yeah, a few folks have. Amazing. Yeah, it's congratulations to those who have, and to those who haven't, it is a lot easier than you might think. I don't know if y'all have seen those memes that are like, me when I realize that I have free will and I can do whatever I want. That's kind of how it felt to me, reaching out to representatives for the first time, realizing that they are just people at the end of the day, and that you can just do that. You can just call up these offices, send them an email, and ask to talk about these priorities. And we have a couple of resources to help make this easier for folks who are interested. So what can you do? Some specific things that you can do if you think, hey, Jackie, this sounds great. I really want to help advance this movement. What can I do? A good first step is always learning more. So learning more about youth peer support, checking out some of these resources I'm sharing to learn about the different kinds of interventions that exist, the different kinds of laws and regulations that exist in your area around youth peer support. And then find out who's doing this in your area. Is there a peer support program in place at your school? Is there a community health center? If you have a hospital in your town, find out if your hospital employs any peer supporters or youth peer supporters in their crisis response. There are a lot of places you can look towards, and there are also a lot of places where you wouldn't expect that are doing this work in kind of cool and unexpected settings. In Delaware, there's a peer support program called Sean's House, which is literally just a former house that is a drop-in center, and folks can drop in and out at all hours of the day and receive youth peer support. It's a really special place. So you'd be surprised at what you can find and who you can find doing this work. So I definitely encourage you all to explore, see what's out there. And when you do, and you find programs that you find meaningful and impactful, tell your friends, tell your teachers, tell your counselors, spread the word as much as you can, both to connect people to youth peer support, but also just to continue to educate people on youth peer support. Because in the research we've done, where we've surveyed people who provide peer support, one of the major barriers that they say gets in the way of them doing their work is a lack of public education around this. Some people have never heard of this. Some people, when you say peer support, they don't know what that means. A lot of people do. Most people do. I would even guess. And so even just like keeping it in conversations, I think, is really important. One of the things that we're doing when we're talking to representatives and legislators, even if, you know, they're not co-sponsoring a bill or they're not like moving forward like a specific piece of legislation, even just knowing, okay, that office now knows what this is. When they see youth peer support come up again in conversation, they're going to recognize it. In my ideal world, you'd have youth peer support be as ubiquitous as saying like, oh yeah, I'm going to go to therapy later. I want it to be that normalized and that destigmatized, because it should be an integral part of care. That was a bit of a tangent, but moving on, another thing you can do, you can write an op-ed for your school or local paper about youth peer support. If you're someone who's benefited from these peer interventions, or even to talk about the benefits of some of the peer-to-peer interventions you're doing in your schools, be a cool way to highlight youth peer support and advocate for policies that will expand it. You can testify at school board meetings. School boards usually have like a public comment for folks to come and contribute to their meetings. So being able to attend those can be very powerful. If you have a student representative, find out if your school has like a student representative position, or sometimes schools will have like student advisory boards. Those can be helpful pathways to start these conversations. And finally, meeting with your local, state, and federal representatives. You know, the federal level is not the end-all be-all. Sometimes you would be surprised at what your city council member can get done, or what your school board member can get done. So really start targeting those specific people. And when I say that, you might ask yourself, where do I start? Like that sounds cool, but I am a little overwhelmed at the prospect. The good news is we've got you covered with resources that have come from our amazing youth leaders. I'll start first. Your first step, again, will be getting that context, getting that background information. So in addition to finding out about what kind of youth peer support is offered in your community, get some context to help identify the problem in the first place. Mental Health America puts out every year this report called the State of Mental Health in America, and it uses all of the latest national data and state data that we have to provide state level rankings on different mental health outcomes. So you can check it out. You can check out your state's own mental health rankings across a lot of different factors, whether that's substance use, youth mental health access to care, all sorts of things. So it's good when you're having these conversations to be able to identify the problem. And it's pretty strong evidence when you can point to, hey, our state ranks 17th for XYZ outcome. So you can follow that link to check that out. And in addition to that, we have we have a companion guide that was written by members of our Young Leaders Council, that was written to kind of go alongside the state of mental health in America. A lot of times it can be kind of a bummer to read that information, to see your state doing poorly, and it can feel really disempowering. So the Young Leaders Council wanted to help people go from data to action, like, okay, this sucks, but what can I do about it? So this resource has a couple different parts. It has a sort of little explanation about how to translate numbers into compelling narratives. It has a decision maker directory. So like I was talking about before, about talking to local, state, and federal policymakers, we have a decision maker directory that covers pretty much anyone that could have some kind of systemic influence on youth mental health. So you can really quickly sort of identify who you might want to contact in your area. Then we have a template outreach letter. So it truly is it's very paint by numbers. You can customize it with your own story, with your own points, but it is a good starting point to reach out to those folks. And we have a step-by-step kind of advocacy plan to walk you through that. And then finally, kind of tucked in at the end, we have a little appendix with lessons learned from our Young Leaders Council members, a lot of whom have been on their own advocacy journeys and have done this work. If you need a little inspiration or just reassurance that someone has done this before and you can do it too, that's great to check out. So I would highly recommend, if you only seek out one resource from this presentation, make it this one, because it really is very valuable. And I'll show you a little example from the resource. This is that decision maker directory I was telling you about. So this is just one section in education. So we have a little section for the power holder. So in this case, we're talking about school boards. We give a description of what they are. So, you know, your school board's run by locally elected officials. They decide on student services, policies, budgets. Then we have an example. So this is an example of school boards having influence on youth mental health. This is an example out of South Carolina, where the jobs of 10 mental health counselors were at risk. So then the school board actually voted to save those positions after getting an overwhelming amount of public comments and pushback from students, staff, and parents in that community. And as a result, those counselors have served thousands of students, completed hundreds of crisis interventions, and referred 40 students for emergency care. So that's just one example of, like, when you feel like nothing ever happens, nothing ever changes. This is one example where showing up to a school board meeting, making their voices heard, helped influence this decision, save the job of 10 counselors, and that made such a huge difference for these students. So it really is these small incremental movements that we can do that contribute to a brighter future. And each example has action steps for, you know, what's your next step if you want to contact your school board. You got to look it up on the website, attend an open board meeting, identify members that are up for election, reach out to board members to share your specific perspective. We try to make it kind of as clear as possible for you to be able to identify those decision makers and then reach out to them. And ideally, reach out about youth peer support if that strikes you. But what are we asking for again when we're reaching out to these decision makers? As a reminder, we talked about some of those policy levers that are helping advance the field, the funding, research, workforce development. If you want more details, you can check out this report written by our Youth Policy Accelerator program. You'll notice that most all of the materials that I'm sharing today are co-written with young people from our programs. So they are really created with young people in mind because they're written by young people. Again, that tenet of peer support, of self-determination, mutual empowerment, you know, young people themselves know what's best for them because they're living those lives. So yeah, for more details, you can check out this report, Trailblazing the Future of Youth Peer Support. It goes over federal policies that fund youth peer support programming, research, workforce development, and some specifics. So if you're thinking, what do I ask for when I'm having these conversations with decision makers? This is a good place to start to guide those conversations. Again, this is in a federal context, but can be applied in different settings. And beyond, okay, so beyond advocating for youth peer support as a student, you can also start to think about how the work that you're doing can influence your future career path if you want it to be. You know, I think sometimes for folks who are advocates for any kind of cause in middle and high school, there can be a pressure to continue to do that into college and afterwards. Know that it is by no means a requirement, but it is an option for you. There's a lot of different ways that you can continue to do this kind of work. My job, for example, is a really cool way to be able to help contribute to this field. I would fall into the policy and advocacy kind of section here, but you can become a certified youth peer specialist. Check out your state's handling of certification. See if you can maybe be certified. In some states, you have to be at least 18. Others will let you do it sooner. Take a look into that. It's also just a cool thing to do. A lot of states, for example, in New York, a lot of states offer those trainings for free. So it can be cool to be able to get certified and have those skills in your toolbox, even if it's not the career you want to do ultimately. Policy and advocacy, you can find careers at nonprofits, federal agencies, coalitions, all sorts of places that are doing this work and pushing this work forward without being in direct services, so not like providing peer-to-peer services. And research, like I mentioned before, we need more research. We need more researchers who are taking this seriously and who are invested in finding out what are effective interventions in peer support. And lived experience is increasingly being valued in these academic settings. That hasn't always been the case, but now it truly is a dedicated field of study where folks with lived experience are being involved in the research, and it's something we want to continue to grow. You could also get involved in program design and management. Those programs, like I mentioned before, like Sources of Strength, like Youthline, they all need trusted adults who are working in those spaces to help support youth peer supporters. And that takes, the sort of back end design, the management, the supervision, and that's another career path you might explore. And then finally, coalition and community organizing. So your kind of grassroots action. That's another thing worth looking into. I do want to be transparent and give you a heads up that this field is still growing. Like I mentioned before, youth peer support is an emerging field. So career paths within it aren't always linear. They're maybe not as clearly established as some other fields within mental health. But that also means that there is real room to shape what this path looks like. Like I said, your generation is the generation that's really shaping what youth peer support looks like. At a larger scale. So I think that that's also a very exciting place to be too. So here's your launching pad. Everything that I mentioned today in one place, at least the specific resources that I mentioned today. Take a screenshot of this, or I'll try and make sure that this is shared with everyone afterwards as well. But these are the QR codes that I'll send you to the resources that I mentioned. As a reminder, you can start with finding out your state's mental health ranking. Then you can see what different states are doing about youth peer support. You can learn what kinds of policies can help advance youth peer support, and then finally you can use our toolkit to make a plan for contacting your decision makers to hopefully advance youth peer support. I've said youth peer support a million times in this presentation, but I really do want to emphasize that that's part of it, is normalizing it in conversations and making it, kind of ubiquitous and universal. So this is a good place to start. This is, sorry, that was a blank slide. So yeah, let's build what comes next. The sort of thesis of this presentation: youth peer support is a movement. You all, again, whether you recognize it or not, you are already a part of this movement. By doing those peer-to-peer interventions, that is in the grand history of mental health care, that is kind of a revolutionary act. And I really want to commend you all for being able to do that and to help build cultures that are less stigmatizing for mental health and where these conversations are commonplace and they're beneficial. So before you close this tab, before you exit out of this workshop today, I challenge you to think of one person who would care about this work and who would want to work on it with you. That could be a trusted adult like a teacher or a school counselor who might be interested in bringing peer-to-peer programming to your school. That could be a friend who might be interested in going and talking to your local representative with you. I really want you to find someone to be your co-conspirator in this work, and kind of hold one another accountable to helping advance this, if this is something that you do want to do. And the timing really couldn't be better, because next month, May, is Mental Health Month. Mental Health Awareness Month was first established by Mental Health America, and it's just a time of year when there's a lot of energy, there's a lot of attention on this subject. So especially when it comes to policymakers, they're always looking for that kind of timely, splashy way to kind of be in the public eye. So it's sort of tying into May and Mental Health Month is really, really great timing for your advocacy. This year's Mental Health Month theme is more good days together. I had this fun little graphic. So Mental Health America is asking people to reflect on what good days look like for themselves and for their communities. And I would argue that youth peer support is one of the most direct answers to that question, because when young people have trained peers in their schools, in their systems, in their communities, more good days become possible for more people, and that's what we're building towards. So again, I challenge you, before you close this tab, to take this one next step, to build a brighter place for youth mental health, and a place where every young person who could benefit from peer support is able to receive it. So yeah, thanks. I'm sharing my email address here. That about wraps up what I have for y'all. So if you have questions for me, please do share. If you want to reach out to me, here's my email address. Feel free to shoot me a message. You can probably tell that I'm very passionate about this subject. Always happy to talk more about peer support and send over specific resources to local to your area if that's something that you want to pursue. Add me on LinkedIn. I am always happy to connect with enthusiastic young mental health advocates. And I'll also quickly plug MHA's Advocacy Network. So we send out action alerts whenever there's an opportunity for you to submit a public comment or reach out to your legislator to support specific policies. We'll put out a little email blast with a quick sort of 5-minute form you can fill out to do that action. So I'd really recommend if you think, whoa, like I don't know if I can really commit to doing this whole thing you just talked about, but I can take 5 minutes every couple months to talk to my rep. That's probably a great path for you. So sign up for that. And in May, actually, for Mental Health Month, we are going to have a dedicated day of action. So sign up for that network to be involved in that day of action, where we're going to be trying to find co-sponsors for the Early Minds Act. So trying to help support funding for youth programming. Yeah, that's about all I've got. I again, super thankful for you for coming here and spending some time with me and listening to me yap about youth peer support. Also, thank you for the work that you're already doing in your communities to build this up. I will go ahead and pass it back to my hosts here.
Thank you, Jackie and Mental Health America, for the amazing presentation. So now we're going to go ahead and ask some questions from the Q&A form. If any questions come up while we are going through, feel free to submit them through the form in the chat still. So the first question asks, how can you contribute to peer support as a younger teen, around 14 to 15 years old? Many peer counseling, peer helpline programs, and even training programs require you to be a lot older.
Yeah, like I mentioned before, a lot of states for specific certification, they do require you to be 18. But there's still ways that you can participate in sort of peer-to-peer programming in your own schools. Even the work that you do with Mind Out Loud, I think, is a big one. I think another thing is just bolstering what folks are already doing in your community. So finding those things like the Sean's House, like the Youth Line, finding out what's available in your community, who's doing that work. And even if you can't participate in providing those services, you can still be a champion for them. And you can still advocate for funding for them. You can still advocate for increased research for them. There are things you can do to help support the work that they're doing without necessarily providing those services.
Yeah, I love that. We do have like a lot of younger students in the program, so I think that's very relevant to them. The next question asks, for students who are new to peer support, where is the best place to start?
So another quick plug. This resource doesn't exist at the moment, but some insider info for you guys. Next week, Mental Health America is going to be launching our Youth Peer Support Resource Hub. As far as we know, it's one of the first resources of its kind. It's going to have a page dedicated specifically for youth advocates, so it'll make everything really easy for you to be able to do this kind of work. I'll be sure to share that with Zoe when it publishes and goes live next week. In the meantime, you might want to check out Youth Move National. They do advising for different youth peer support programming in a lot of different states, and they have a lot of good resources too. So yeah, I can also send out links to that. They're also a great place to start for youth specific peer support. That's Youth Move National, MOVE.
Yeah, thank you for that. And then this last question for now asks, you mentioned peer support and policy change. How can students ensure their voices are taken seriously in spaces that are often led by adults?
That is a very good question, and definitely something that comes up a lot with the youth leaders I work with. Ageism and adultism is a very real thing, and it's good to know that going in, that you're kind of working at a disadvantage in some ways. But there are tactics that you can use to kind of offset that. One of that is finding a trusted adult who can help vouch for you, not someone who will, take over a meeting. Sometimes you just need them to get you in the room. A lot of times I hear about young people who having like a teacher or a school counselor being able to kind of vouch and say like, this is important and we need to talk about it, just to like get you in that space. That can go a really long way. So if there's an adult that you trust, that's a good start. Another thing I think is that oftentimes when policymakers are thinking about meeting with young people, they think, oh, they're just going to tell me their story. And that doesn't, not that it doesn't matter, but it's less meaningful to them. But there's ways that you can weave your story, weave your experiences and narrative in with data and compelling research that shows that there's a real problem and also shows that there are solutions. And that resource from the State of Mental Health in America the advocacy toolkit, translating data into action, that kind of helps with that process of being able to back up with what you're saying, where it then doesn't just become, this is my individual story and journey. It's also reflective of what's happening at a systemic level in your area. So that can help bolster your argument and make sure that they take you seriously, because when you come in with the numbers, when you come in with the backed up information and data, it really does make a difference in your credibility.
For sure. I think that's very valuable advice and something that I know a lot of us have definitely have concerns about, especially working with adults as youth advocates. So since there are no more questions in the forum, we would like to thank all of you and also our guest speaker, Jackie, for joining us tonight. In a second, there's going to be a feedback form in the chat, so please fill that out to let us know how we did and help us improve future sessions. And if you're interested in joining future monthly workshops, make sure to visit our website. Thank you all for joining.